diarrheagenic E. coli. Okay, diarrhea causing E. coli are which one? You already know them. Okay, the various diarrhea causing E. coli, that is, one is EPEC, one is EIEC, okay, one is ETEC, one is EHEC, and one is EAEC. Okay, so enteropathogenic E. coli, this particular one, enteropathogenic E. coli, this causes pediatric age group diarrhea. This causes what? Pediatric age group diarrhea. Remember that P for P, that you already know. Okay, and this particular EPEC associates with A oblique E lesions. Remember this aspect. A oblique E means what? Attaching, effacing lesions. Okay, what they are termed as attaching, effacing lesions means they attach to the intestinal villi and they damage them. So this is termed as A oblique E lesions, and they are seen in the EPEC. This is a definite, it can come in the exam. Antero-invasive E. coli. Antero-invasive E. coli resembles shigellosis. Okay, as it is invasive, Shigella is also what? Invasive in nature. So antero-invasive E. coli resembles shigellosis, and a test is positive in this, and the name of the test is what? Serenity test. Okay, Serenity test is positive in the EIEC. Fine. Then you have this, that is ETEC. ETEC is enterotoxigenic E. coli, and this you already know. This is traveler's diarrhea, most common cause. Okay, the most common cause of traveler's diarrhea worldwide is ETEC, enterotoxigenic E. coli. Is it fine? Now, how to remember T for T? So, remember in this particular aspect, somebody from America comes to India, and in India also that individual comes near AIMS to Gautam Nagar and drinks our water. That fellow will definitely land up where? In the AIMS. Okay, so this is what is ETEC, that is enterotoxigenic one, leads to traveler's diarrhea. Is it fine? So that fellow have to be admitted in the hospital with the complaints of traveler's diarrhea. Then enterohemorrhagic E. coli, which we are talking up here, this particular one secretes up certain toxins, and these toxins are named as virotoxins, that is VT1 and VT2. So this was also being asked once. VT1, VT2, what is it? Virotoxin 1, virotoxin 2. So that also is important to remember, that virocytotoxin or virotoxins 1, virotoxin 2, these are secreted by this EHEC, and this EHEC leads to which disease? It leads to HUS in the children. And what is HUS? HUS is hemolytic uremic syndrome. Okay, what is HUS? It is hemolytic uremic syndrome, and in the adults it does what? Hemorrhagic colitis. In the adults it does what? Hemorrhagic colitis. Fine. So these all are important entities to be remembered regarding the diarrheagenic E. coli. Okay, and the last one is enteroaggregative one, which leads to persistent type of diarrhea. This particular one leads to what? It leads to persistent type of diarrhea, and this persistent type of diarrhea which is there caused by this EAEC means over the weeks the diarrhea happens, and in the enteroaggregative E. coli also you need to remember this aspect, that it also associates with traveler's diarrhea, and obviously the number one cause is ETEC, and EAEC also does what? Traveler's diarrhea. Fine.